that patients come for requesting. Just to have a general overview of what really vocational rehab is and what functional rehab is I'm going to go through them each as a general topic, and then we'll try to summarize at the end. Functional rehab is just really a pattern of motions to use multiple joints acting in various ways in multiple axes and planes. Basically, it is to bring back the function of the patient to do a certain activity or job function that it was doing prior to the injury. So in order to get a successful functional rehab, you really need to stimulate and recreate the patient's need for that particular skill or particular motor event that it needs to perform to do that job. Or it could be a sport, it could be any kind of a, even a desk job, to be able to sit in an appropriate manner, to type whatever the patient needs to function, to work, to go back to what it was before the injury. So the basic, again, the goal, is the major goal in any rehab, is to restore the range of motion of the joint, restore strength, proprioception, to get back mostly the confidence to go back. So a patient who's injured needs to be able to be back into the functional level quicker than later. The longer they stay out, the more likelihood they will never go back. So quick and quick better is the goal. You would like that? Okay. So the components, again, we're just going through quick little phases. Our rehab rotator would know all of this stuff. Is phase 1, phase 2, phase 3 is basically the acute phase, the repair phase, and the remodeling phase. Well, basically trying to get the patient back to the pre-injury status, to go back to work to be as functional as it was prior to the event. The other thing that you need to really deal with person who has whatever injury attained during employment or during an activity or whatever is to address their anxiety and also to address their apprehension of going back to do what they were doing prior to the event. So if you can get these and get them motivated back, get them functional, the quicker you do it, the better chances are that they will go back to full time. The designing, of course, the program is person-to-person dependent, and it is dependent on their particular need for whatever program they have. There is no one program for across the board. The guidelines usually is, what is the patient currently at? What is their level? Was it before? And what is the expectation of the level that is needed to go back to whatever they need? Whether it's a support, like if they had a football injury or whatever, that's the most people can understand, is then they need to go back to training again. They need to go back to do that sport again, so they need to get a program that will get to them functional. If they were a laborer and they were doing construction, they would need to be able to, is their goal to go back to that same construction job? Or is it to be going back to a desk job? So you need to understand what the goal, what the expectations, and what is need of that patient to go back to. Full return to whatever position. It could be an athlete, it could be a computer person who had carpal tunnel, and the injury of the carpal tunnel post-surgery needs to get that hand functional so they can go back to typing. So the criteria is basically get the patient as quickly as possible pain-free, to get back their range, their strength, get back their confidence to go back to whatever they want as quickly as possible. In all of these conditions on where a patient will become permanent inability to go back to work will depend on how quickly you can get them back to where the status they were at prior to, not only functionally, mentally and physically. Mentally sometimes is the challenge. So there are many testings that can be done. The purpose of the testing is really determine where's the injury, what you do need to do, can the patient tolerate what you need to do to get him back or her back to where they were. The assessment of both the unilateral and bilateral functional status of whatever limb or area of injury, and to get them appropriate. It's just a repeat of everything I've just been saying. The limitation is that there is no comparative normalities to a baseline. You don't have pre-values of what they were. You have no really basis. It's just all objective decisions that are made per person to person. And it's important on who's doing the functional testing, who's getting it back. Does the person who's training the patient, is he understanding what is necessary or what is needed of them? Vocational rehab is basically, it depends on each person again, and also the financial situation of the patient as well. It's to serve people with disability in obtaining or retaining employment, to come depending on their abilities and interests and limitations. So it's basically obtaining what disability do they have. The services, vocational services, the people who are eligible for these services have to have a physical and mental impairment. This is a definition, must have a physical and mental impairment, which for such an individual constitutes or results in a substantial impediment to employment. So in order to meet and have requirements to go to vocational rehab, you need to meet this particular statement. The description of a specific employment outcome, it's the description of a specific rehabilitation service. This is really what we need to look at, is a definition of what impairment is and what disability is. By the Social Security Administrative, an impairment that is defined as a result of an anatomical, physiological, psychological, remember, psychological also plays a role, anomalies which can be shown by a medically acceptable clinical and laboratory diagnostic techniques. States that the physical or mental impairment must be established by a medical evidence consisting of signs, of symptoms, and laboratory findings, not just the patient's own statement of a symptom or a situation. Anybody can assess impairment. Any medically licensed person in the United States can do a disability paper, can assess for impairment. Anybody who holds a active license in any state, doesn't matter what their specialty is. Disability defined by the Social Security is also defined, and it has to meet these criteria for Social Security disability. And then there is the workman's comp disability. The Social Security one is basically inability to engage in any substantial gainful activity by reason of medically determinable physical or mental impairment. Okay. And of course there is a period of continuous period not less than 12 months. Workman's compensation is basically a disability or a reduction of ability to gain wages is if it's acquired during the period of your work time, wherever the employment of that job, during a job event. So the difference between impairment and disability. One individual can be impaired significantly but have no disability. However, somebody can be disabled and have no impairment, and disability can be temporary or permanent, can be partial or total. Workman's comp is also covered by what's called a no-fault insurance program for injury or illness. These are all technical, but these are all what we're going to go through. Some of these workman's comps and no-fault cases will also require if the patient is fit to go back to work. They will ask you for a paper, or they'll ask you a letter, say about discussing the fitness for duty. Is the patient fit to go back to work? What are they able to do when they go back to work? What is their functionality? I personally do not do it in the detail which is necessary. That's why I choose not to do it. But a small letter, some patients just want a little letter saying the patient can go back to work. He's okay. But that is required. A true fitness for duty has to be done performed by either a physical therapist or occupational therapist in a environment that could take for hours, basically stimulating and creating the job that the person does for a living. And it has to be done, it takes about hours. And it's a specialty area. I think NYU has one of those, do they? Yeah. And it takes 4 hours. So, but there are many physicians who are licensed physicians can say the patient is fit for duty without sending them. But the appropriate manner is to send them to a physical therapy or occupational therapy who has that capacity to do a functional test in an environment that could stimulate or simulate their work environment.
How do you approach, this is just something that came up, how do you approach a patient where you do think is appropriate for duty, but they give you a piece of paper that says, I need you to sign this for my disability. They want, you know.
First of all, as a fellow, you can't sign. 2, you have a choice not to do so.
Not to do so?
Not to do so. Once you sign a paper for disability, it doesn't end with a signature. A true disability form will come back to you, and it'll be about this thick, about 10 pages or long, with diagrams of range of motion of the shoulders, of the legs, of the back, of the neck, in degrees. Then it will ask you how much weight can they lift, can they do, can they turn. It's a breakdown. It's about 10 pages long. So signing that paper is great and very quick at that time period. Just remember that there's going to be a follow-up through on a big forms that you have to fill out. That could take you for at least an hour. Okay? So any physician can fill out, a medically licensed physician can fill out a disability. Anybody can. They don't have to, a psychiatrist, a ophthalmologist, it doesn't matter what their specialty is. But a true assessment of a disability should be done by sending them to a special centers where they do functional testing so that they can get it correct. All right? Performing, there's many ratings. There's an impairment rating. It's complex. It really needs to be done in a set structure, and evaluation is requested by the patients by the institutions where whoever's sending you to the patient of the overall functionality and limitation of this person. So it is important. There's a lot of people who want disability. Whether the number one, what's the number one reason why people ask for disability? Where pain? Back pain, low back pain. That is the number one reason for patients who come here for low back pain. Number 2 is for a disability is they have psychological impairments which justified by a psychiatrist that can inhibit them, and they can have it. But number 1 for your door as a pain management doctor or rehab doctor is low back pain.